Skye's mission is to pioneer and commercialize the first CB1 antibody to tackle current and future unmet needs in obesity. Today, 40% of adults in the United States are living with obesity, and in the next 10 years, that number is expected to increase to over 50%. The recent success of GLP-1 receptor agonist therapies is unprecedented, but the competition for the GLP-1 space is incredibly crowded, with multiple marketed and soon-to-be approved drugs in development. Unfortunately, they all have the same problem: safety, tolerability, and adherence. Moreover, semaglutide, otherwise known as Ozempic or Wegovy, is expected to go off patent by 2031, enabling a wave of generics. Not to mention the competition for cheaper GLP-1 drugs in development from China. Nimacimab has the potential to become the first to-market CB1 antibody that can address a large patient segment that does not respond to or cannot tolerate GLP-1s, while also providing a combination option for those that need additional weight loss. There are multiple unmet needs that current GLP-1 therapies are not fulfilling. We believe there are opportunities to improve tolerability, improve adherence and compliance, provide optimal weight loss through combinations, and demonstrate healthier and more durable weight loss by preserving lean mass. More and more data is becoming available from real-world experience using GLP-1 therapies for weight loss. What we are learning from these data is that the discontinuation rates from these drugs are much higher than what was reported from their respective phase 3 studies. In addition, it is becoming clear that one of the main reasons people stop taking these therapies is because of the gastrointestinal issues caused by these drugs. Why is this important? Well, it speaks to the fact that patients are unable to stay on these drugs for a long enough period to achieve the benefits promised by these weight loss drugs. With all of the excitement around the effectiveness of these new weight loss therapies, we seem to have been clouded by what an effective weight loss drug needs to achieve. That is, this apparent expectation that the next wave of weight loss drugs should demonstrate over 20% weight loss is misguided. The fact is that the overweight and obese population in the US is quite heterogeneous, with most people having a BMI between 20 and 40, and as such, not requiring these extremely high weight loss numbers. Our primary research with physicians has highlighted that a useful and meaningful therapy should demonstrate at least a 10% weight loss at 1 year, and that drugs that can result in greater than 20% weight loss alone or in combination would be reserved for patients with a BMI above 40. Our research has indicated that Nimacimab can occupy a broad addressable market as both a monotherapy as well as in combination. Physicians believe that with Nimacimab's potentially safer and more tolerable profile, it can be used as a monotherapy for patients who are GLP-1 non-responders, particularly those unable to lose greater than 5% weight loss at 3 to 6 months, GLP intolerable who are at risk of cardiovascular disease, class 1 or 2 obesity with mild to moderate GI side effects on GLP-1 therapies, patients who have prior history or are at risk of pancreatitis and thyroid cancer, the elderly greater than 65 years of age who have or are at risk of sarcopenia, and any patient at risk of sarcopenia, patients with concerns about muscle loss, such as middle-aged men, and patients concerned about or apprehensive towards GLP-1 side effects. Moreover, Nimacimab can also be used as a maintenance therapy for patients who have reached their weight loss goals on GLP-1 therapies but do not want to stay on therapy because of intolerance issues. Lastly, as a combination, Nimacimab has the opportunity to be used with GLP-1 therapies in patients who have class 3 obesity, who require significant weight loss greater than 20%, or initial GLP-1 users who have class 3 obesity and require additional weight loss once they have reached a weight loss plateau, or are unable to achieve weight loss goals due to tolerability issues at the highest doses of GLP-1s, and are unable to achieve their weight loss goals due to a limited response with a GLP-1 alone. Taken together, these addressable markets suggest that Nimacimab as a monotherapy and combination therapy represent a multi-billion-dollar opportunity.